we were cruising along, man. We're living in suburbia, nice, young professional couple with these beautiful kids. And
then we became pregnant with our third child, PJ. I found a lump in my breast, and I had breast cancer.
We both had a lot of concerns and fear around beginning treatment with chemotherapy.
In order to save my life, really, they said that we would need to go ahead and start chemotherapy right then. Then we delivered, and he, was just perfect, just beautiful little baby boy, and there's the only thing wrong with the fact that he had low platelets.
Believed to be from the chemotherapy, but which affects your blood counts anyway.
PJ developed an infection on his scalp, and as a mother, I just became convinced that something was wrong that they were not catching. And I found an infectious disease specialist who's also a pediatrician, Dr. Terry Yoder. And within 5 minutes of being in the room with PJ and us telling the story of PJ's history, he said, I think it's possible that he may have Wiskott-Aldrich.
PJ was patient 349 in the world. So it's not something that a clinician is used to seeing.
I didn't understand at the time that we got the diagnosis, the full effect of that, the fact that it would cause him to die at a young age from some infection.
We were pretty quickly on the path to getting a bone marrow transplant. It's a real intense process. They give what they call high-dose chemotherapy, and the goal of the high-dose chemotherapy is to wipe out the patient's bone marrow, which is their immune system.
Of course, he lost all of his hair. He became very bloated. Having been through chemotherapy myself, I knew what he was experiencing physically. It was very hard for me to watch.
And we had seen 5 other children die while we were there, out of the 16.
And so that was very hard.
I remember one day in the unit dancing with PJ, holding him in my arms, and he had his cords coming out, and just holding him for hours and trying to comfort him and listening to the music, and just experiencing and finally saying to God, okay.
Savannah's our oldest daughter. By God's providential will, her blood matched perfectly. Now she says, my blood helped PJ survive. Mm-hmm. My blood helped him live. Mm-hmm. To me and to all of us, this is a Red Sea parting. God came down. God came down.
How are you doing? Good? You good?
Yeah.
He's been cured from a disease that would have taken his life.
Can you do a big breath? You can go.
That they couldn't treat just 10 short years ago at all.
Are you 2?
2.
Okay, you want to get down? All right.
Okay, partner.
Okay.
Clinically, he is perfect. His immune system functions normal.
You look at him, and it's like he was never sick.
And he's extraordinarily happy. He is just a
jubilant.
happy person.
It would have been easier to know, for me as a mother, to know other mothers, other families that have been through this, and to feel a connection with that there are other families out there.
What we found is that most of the financial resources were geared towards people with diagnoses of cancer.
Because so many people want to help, and they say, we'll do anything to help, but not only did these friends of ours want to help and say, what can we do to help, but they went out and they have helped.
I gathered with a group of friends, former fraternity brothers. We decided that to do more than just help this one family, that we would create a legacy and name it in honor of P.J. Lyle, and hence the name, the For Pete's Sake Foundation.
The foundation can provide a real unmet need out there for families that are going through this. Mm-hmm. If it's just living expenses during the time of a transplant or time away from work.
And to be able to support another family, to be able to comfort another mother, and it is a great gift.
I think educating families and clinicians about the existence of the disease and how it might present so that you can get earlier diagnoses,
Right.
which improve treatment outcomes.
God orchestrated all of these circumstances and all of the things that we have been through, and we can see His hand through each one of these circumstances and everything that we've been through, and has brought it to a place where we can be used for the greater good.